All right. Good evening to everyone present here and the viewers who are watching us. I'm Oditi Padgiri and I shall be the host for today's evening. And here I am with you all, bringing another session under community health. So before starting, I would like to give you all a little bit brief about Anajuri. Anajuri, in simple word, is a hello.
Oditi, you are on mute. Please proceed ahead.
Am I audible?
Yeah, you are.
Okay, Rishi, can we start again if you don't mind?
Please proceed ahead. We are already on live.
All right. Okay. So before starting, I would like to brief you all about Anajuri. Anajuri, in simple word, literally means the bond of love. Milind Datta is the founder of Anajuri, and it is his love for his native land that brought him back from USA to Assam in order to start this non-profitable organization that engages and promotes various initiatives such as striving for social change, loving leadership skills, and building entrepreneurship capacities among the people living in Northeast India. For a couple of months now, we have been interacting with speakers from various parts of the state. And today, we are very happy to have four speakers from the field of medicine with us. আৰু এনাজৰী এনেকুৱা এটি সংস্থা যিয়ে মানৱ জীৱনৰ লগত জড়িত হৈ সকলোকে এনাজৰীৰ দৰে বান্ধি ৰাখে, যাৰ বাবে সমাজখন বহুত উপকৃত হৈছে। সেয়ে অকল শিক্ষাৰ ক্ষেত্ৰতে নহয়, বিভিন্ন ধৰণৰ বিষয় যেনেকি জীৱ-জন্তু, শিশু আৰু মহিলাৰ সুৰক্ষা, স্বাস্থ্যৰ দৰে বিষয়ৰ ওপৰত আলোচনা কৰি এনাজৰীয়ে সকলোকে একেলগ কৰি ৰাখিছে। And today we will be talking about the topic choosing medicine, a journey from aspiration to reality. We have four speakers joining us today. We have Dr. Tribenee Barman, who is an MBBS graduate from Assam Medical College. We have Abhinab Saikia, who is a first-year student studying in Gauhati Medical College. We have Mahir Daiyan Choudhury, who is again a first-year student studying in Hamdard Institute of Medical Sciences, New Delhi. We have Debpratim Bora, who is a second-year student in Jorhat Medical College. So it gives me immense pleasure to welcome all of you in today's session. And I think it is one of the first session in Anajuri where we are hosting four speakers together. And yeah, so to proceed with, I would move on to the questions. And if you all have anything to say before that, you all can. Or should I move ahead with the question?
I would just like to thank you all for this opportunity, Aditi and the team.
Thank you so much. Well, so my first question will be for everyone. So again, we were always asked about what we want to become in life when we grow up, right? And I think every child's answer was that I want to become a doctor. But again, as you can see, people like me who has completely diverted from that very idea. But you all are now already in that journey where you can tell people that yes, we wanted to become doctor and we are doctors now. As again, we have Tribenee Barman, who is already an MBBS graduate. So I want to hear from all of you what made you all stick to that very idea of I want to become a doctor. We'll start from Tribenee Ba.
Okay, well, if you are good at science subjects at school, then conventionally everyone assumes you would either choose medical or engineering. And to be honest, I always wanted to become a doctor from childhood, and I think it is one profession which gives you the chance to become healers and to be of value in the society, to give a meaning to life, and also the career. I think it's have job security, social security, respect, and uh, diverse opportunities for careers, and all these things to have made me choose medical. And I'm grateful that I could live my childhood dream.
All right, thank you so much. We'll move to Mahir now.
Good evening, everyone. So, the first reason for me, personally, and a lot of people out there will be it was for my parents. I joined MBBS. Everyone wants a doctor in their family. I never personally wanted to be a doctor, but eventually, when I explored this field, that it is such a noble profession and one of the best ways to serve the society, I was happy to choose this path. This profession gives you the power to make people happy and healthy. So what else do you want to contribute to the society? So that was my only reason for joining MBBS.
Thank you, Mahir. Next up, we have Debpratim Bora.
So to be honest, first of all, I don't have the aim to become a doctor. First, I was thinking of becoming an engineer, but যেতিয়া মই class 8 পাইছিলো, so my mother suffered from left breast carcinoma. So during her treatment, I noticed the service that was provided by the doctor to my mother that inspired me to become a doctor.
Thank you, Debpratim. Next up, we have Abhinab.
Good evening, everyone. I'm Abhinab. So, to be honest, when I was really young, suppose like class 4 5, I actually wanted to become a scientist. Okay, I was actually really in tune with how it was really cool to, just be someone who is in tune with science. But during like class 8 to 9, and when mainly COVID started, I saw how noble the profession actually was, the profession of being a doctor. And just knowing more about our own body is just so interesting. I feel like even though I don't know if I will be a scientist in this field or not, but it just feels like knowing more about my own body is in a boon of itself. And it just feels really nice to be in this field. That's all.
Thank you, everyone, for your replies. It was again amazing to hear about your personal journeys, which led you all to actually joining this session today. And okay, so moving on to our next question. So now I want a very student point of view when I ask this question. Again, we keep on hearing about like there are doctors who talk about there are, say, lack of, say, infrastructure when it comes to Indian medical system and etc. But I want to hear from all of you that different challenges that you all went through as a student. Again, as in this very session, we have 3 people who cracked NEET and joined the medical college, whereas we have Tribenee Barman, who joined medical college through her percentage, if I'm not wrong. And
We had CWE at that time.
oh, okay. So again, but still 2 different systems, right?
Yeah.
And yes, so now I want to hear from you all the different challenges that these systems affect you all in some way. What kind of changes do you think that the government should make, or should or address different issues related to students? It can be anything. It can be related to the seat capacities in the medical colleges in India. And as all of you are from Assam, you all can address that as well. Or maybe I have seen many people who couldn't join medical colleges because of, say, lack of money. So I want all of you to address this question from your own perspective. We will start with Abhinab.
So to talk about the journey, I would say the three speakers who have cracked NEET recently, we will all understand how high of a competition we have. This year in itself, we had around 23, 24 lakh students. And if we include the seats from private colleges as well, we have, I think, something around 1 lakh 8,000 or something around those seats. So it is a very competitive field, I would say. And even just joining it is a very hectic process, I would say. And about how you said about lack of financial funds and stuff, I have seen that there are some scholarships to get into medical field, but the lack of awareness of these scholarships is also quite noticeable. I have seen that there are one or two messages in our group for these scholarships, but there is no actual campaign or anything like that. That we suppose one of the social media fronts is just advertising that yes, there is this scholarship program, and yes, if you fall in these categories, you can definitely apply for it. That is one of the student POVs I can give you for now, Aditi.
Okay. Thank you, Abhinab, for addressing the question. Next, we'll hear from Mahir.
So this is a very interesting question. Me being from a deemed college, I don't think the only good thing for me being from a deemed college is we don't feel like that we have infrastructure problem and stuff, because of course it's a private college, private institution. So I would like to give you some stats about the medical field. So according to the Times of India, we have 1:8 for 1:834 is the ratio of doctors patients in India, and the WHO norm is 1:1000. So India is doing better. According to the stats, India is doing better in the medical field. So but the problem with India is that the quality of medical graduates, Indian medical graduates, had been declining. There are several reasons for that, and I believe that as Abhinav have already stated, this year's competition, Indian student is not demanding much. Indian student is demanding for a fair exam and for a
I request everyone to kindly switch off their mics if they are not. Yeah, I think you can continue, Mahir.
Like I was saying, so Indian student is not demanding much. The only thing Indian student is demanding for is a fair exam. So the system should be fair for all. Like in Assam itself, I would like to give you an example of the government school quota which was introduced this year. So according to the norms, the reservation should be capped to 50% of the total seats. But I don't believe in Assam it's capped till 50%. It's more than 50%. I myself have scored 605 marks and the cutoff was 610. So I know the pain of the students who are very near to the cutoff but could not like make it to a government college. So as from my perspective, it's a very very bad thing going on in the counseling itself. This year's counseling was also in Assam itself. This year's counseling was also very shabby, very shady, I would say, because they were continuously postponing and preponing things. In my college itself, because of this, in my college itself, we have a student from Assam. She has cleared the cutoff, but because of the counseling process, she had to come to a private college. So I would like to say that Indian student just requires a fair examination and a fair system which analyzes their capabilities to the fullest.
All right. Thank you, Mahir. Next up we have Debpratim. And if I'm not wrong, you cracked NEET last year itself. So how was the process different from Mahir and Abhinav for you?
Actually, it was I did not have the experience of becoming a dropper, so maybe they have a better perspective of what like a process of going through a journey to crack something is maybe different from them. But I agree with Mahir because almost Assam has 13 medical colleges. Huh? So that from among 13 colleges, কিছুমান মানে বিভিন্ন ৰিজনৰ কাৰণে কি হয় সেই নতুনকে খোলা মেডিকেল কলেজ কেইখনত পেচেণ্ট এক্সপ'জাৰটো কম আছে তো তাৰ কাৰণে কি হৈছে মানে মোৰ কিছুমান ফ্ৰেণ্ড যোন লাইক দিছ ইয়াৰ দে গট চিট ইন তিনিচুকীয়া ইভেন some old colleges like Tetzpur Medical College also তাত মানে পেচেণ্ট এক্সপ'জাৰটো প্ৰপাৰ নহয় যাৰ কাৰণে I think students can't have proper exposure to the patient and this hamper their skills. সেইটো এটা problem হয় আৰু এটা problem Ba will also agree after entering the MBBS course the level of stress that we have to suffer. More recently first MBA exam দিছো then the total environment of that exam is so different মানে ইমান pressure থাকে কম সময়ৰ ভিতৰত lots of things we have to do so মানে এটা stress management tips মানে অলপ তেনেকুৱা কোৰ্সো provide কৰিব লাগে আৰু from the NMC.
Okay, thank you, Debpratim, for your point of view. Now we have Tribenee Ba. Now your difference is, I'm sure it's different from the three of them, right? So now we will hear from you. You can switch on your mic.
Yes.
Yeah, I totally agree with three of them. They cracked their entrance recently, so they know the pain and the hard work and the stress any medical aspirant or a medical student has to go through throughout their entire life. This is just the beginning for them, and this continues lifelong because as it is mentioned by one of you that many colleges, almost 13 medical colleges are being opened in Assam, but without proper infrastructure. And this is increasing the competition not only in NEET UG but also in NEET PG because the UG students are increasing significantly, but the number of seats in PG is still the same. So there is immense competition in that after passing MBBS also, and also because of the mushrooming of all the new medical colleges, the new strategy of medical college in every district. It's hampering the quality of healthcare provided because instead of focusing on that, the government should focus on developing the already existing medical colleges and hospitals because in many of them outdated technologies are used, proper infrastructure are not there. Even some old colleges like Tejpur, Jorhat, Borpeta medical colleges, basic infrastructure, basic equipments are not there. So just creating students without proper facilities to the patients, it's of no use, I think. So that is the main problem, I think, medical student after passing MBBS process. And also there is a shortage of workers. We have to complete those who are doing completing MBBS from Assam, they have to do rural posting. When we go to rural areas, there is always a disparity. People have more access to healthcare in urban areas, and the rural area people are quite ignorant about healthcare. They don't know. They still resort to conventional superstitions, and they're quite ignorant towards allopathy and doctor, and it becomes very difficult for us to communicate with them, to persuade them to take and to get tested, to get their health checked up. So all these things arises when a person have to actually go and work in the field. And also there is shortage of people there, healthcare workers there. So already working doctors, they have to face they are overburdened with work. And also because of this lack of infrastructure and everything, because of this, all the blame is put always to the doctor. The government is never to be blamed. So I think medical student in India working in rural setup and in government setup, these things are faced by all.
All right. Thank you so much. Again, hearing from four of you, and four of you are going through different things. Tribenee Ba is giving us a viewpoint about what her journey has been in this field, because she has been there for like at least 5 years now. We have new joinees like Mahir and Abhinab, and the Debpratim, who is in his second year. Again, this brings me to a question, and this question is for Mahir. And again, I know you are a very new joinee to the team. It's your second year. So I want to know from both of you, and also like Debpratim is in Assam right now, Mahir is in Delhi. So I want to both of you about your classroom. I particularly want to know if there is a gender gap, and like which you could feel in your class. It can be the number of numbers, or maybe the other unfair practices as well. So we'll start with Debpratim.
In our college, তেনেকুৱাটো gap একদম নাই বাৰু একদম equally all the skills were taught and all the lectures were provided, but আৰু এটা perspective আহি যায় from the patient point of view. মই মানে যিমান দেখিছো, our hospital is situated on a rural place only. তো patient perspective পৰা কি হয়, কিছুমান এনেকে মানে মই শুনিছো আৰু মানে নিজৰ মাজত কথা পাতে যে আজি কোনে চাৰ্জাৰী কৰিব, আচ্ছা তাই ছোৱালী হয় ন, মেবি ভাল নহ'ব পাৰে, তেনেকুৱাকে ডিছকাছ কৰে ফ্ৰম দ্য পেচেণ্ট পাৰ্চপেক্টিভ। আৰু ফ্ৰম ষ্টুডেণ্ট পইণ্ট অফ ভিউ বা এডমিনিষ্ট্ৰেশ্যন পইণ্ট অফ ভিউ, they give the all skills and knowledge equally. There is no thing like gender gap and all, but from the patient perspective, there is some meet, their local issues are there, so they just creates gap by their own.
Okay. Thank you, Debpratim. Mahir.
So this is a very good question. So the Indian stereotypical mentality is that बेटी होगी तो डॉक्टर बनाएंगे, लड़का होगा तो इंजीनियर बनाएंगे. But I think this trend is drastically changing nowadays, because in my own college we have equal number of boys and girls. Like it's actually equal, 75 girls, 75 boys. So I believe this is changing. I agree, in comparison to other professions, the girls are more in our course for sure. So but I feel this is a ideal situation where equal number of girls and boys are present in the course. In teaching, of course, as Debpratim have stated, there is no disparity. Everyone teaches the same to all the students, but of course the patient's point of view come. My hospital being in an urban area, so it does not affect us much, but of course in the rural area there is some disparity. So my college is a deemed college, so it is very nice to see that it is very expensive also, so it is very nice to see that people are investing in their girl childs too. So that's it from my side.
All right, Mahir. Again, thank you for letting us know about the patient's point of view. Important for us as general audience to know about what goes behind the scenes, right? And Abhinab, it is a follow-up question. Again, the recent case that happened, right, in Kolkata, and which made all the girls at least rethink about their lives and if we should step out outside at night. But I want to hear from Tribenee Ba and Abhinab as well again, that did it make you rethink about your career choice? And again, Tribenee Ba is a female doctor here, and again in this session itself we can see that there is only one female doctor and the rest of you are male, right? So, and what goes on in an hospital? Like, I have, again, there are nurses, there are other fourth grade workers who are females. Do you think that affects how government works how government is making changes in the whole structure, or what should be the next step, basically. Tribenee, I will hear from you.
Yeah, the gender gap, it's just like you asked the previous question, it's not seen in the years when you are studying. When you go to the field, when you are actually working with patients, you can definitely, a female doctor definitely faces the gender discrimination, because mostly the rural people or the people with patriarchal mindset, they think that if someone is sitting in the hospital, be it doctor, maybe how much qualified that girl is, they will always resort to call you a sister. They find it difficult to call a ma'am to a girl, a female doctor. But but to the boys, even when they were students, they will call them a sir. So that's the mindset of rural people. That's what goes on actually in I don't know in urban areas, but mostly in village areas that's the same. And I have also done 1 year rural posting in rural. That's the compulsory rural posting. I have again faced that. Even when I'm sitting in front of the patients, they still call you sister. They think that girls are always, they will be nurse only in the hospital, and that's the mindset of people. That's very difficult to change. Of all the, and not only all the illiterate people, also the educated ones, they think such in such a way. So that's really disheartening. Uh, and also the recent case that happened in Kolkata, that's such a spine chilling incident that happened. And it definitely always, our parents, our relatives are always concerned about us. The same thing happened in Assam Medical College in 2014, just before when I was about to join my medical college. It's in the same college. So it definitely scared me off. But after all, the passion to become a doctor, the desire to become the doctor was much more. And obviously, the doctors are anyways nowadays facing many uh, harassment from attendance, patient, and so nowadays they are not sparing female doctors also. Mostly the patriarchal mindset people, they think of male as the power, as superior, and female to be fragile. And the power, if any female raises her voice against something, they try to suppress her voice by doing various kind of sexual harassment, mental harassment, and all these things, which is very, this should not happen, because our uh, duty doesn't discriminate between male and females. We are given equal duties for the patients. So government, I think, should be, the infrastructure should be made in such a way to ensure safety of female doctors at night duties and everything. There should be proper restrooms, proper resting rooms, proper security guards when a female doctor is at night duty, at any duty. I think that.
All right, Triveniba, it was again amazing hearing from you what goes behind the scenes and what you have been through as a female doctor. Abhinab, next we would like to hear from you on the topic.
So let's first address the elephant in the room. সেইটো হ'ব যে আৰজিকাৰ যোনো হৈ গৈছিলে সেইটো আমাৰ countryৰ one of the lowest points হয়, and lowest in the sense that বাহিৰৰ ফালেও, like in foreign countries, it is known that India is not particularly safe for women. Okay, like যেতিয়া অনলাইনৰ কমেন্ট সেকশন এটাতে যোৱা ঠিক আছে তেতিয়া দেখিব পাৰিবা যে sometimes the people from suppose say US or maybe Canada, I don't know, so they will go on about how India is not safe. And as Mahir is from Delhi, he might also hear the term that Delhi is not safe for women. I'm just referring to India as a whole here, but it just feels like that what happened in Arjikar is like something which is, as Ba said, spine chilling, and something that we don't want to have a precedent ever again. It is something that can be prevented, and I hope that government actually takes steps against it, because being a doctor is a very noble profession, as it was said earlier, and you are already dedicating your all to this service, and then these kind of incidents happen. I have had one of my female friends text me after that incident about how she is scared to even study. She is actually trying to go for NEET in the next year, 25. And she was about how scary this is and how it is one of the things that wants her to not prepare for NEET anymore. It is one of the factors which obviously affects the entirety of this country's population. And about the gender thing, one of the funnier, let's shift to the funnier side right now. So another one of my female friends, she is a second year student right now, and I think she is having clinical postings because just as Ba say, she was referred to as sister, while I was referred to as sir. I'm just a first year student who is just having his foundation classes, and with the uniform of my college, it's a bluish shade color, so it's kind of distinguishable in the crowd. So when I was passing through a person, I politely asked, "Excuse me," and then the person went, "Oh sir, jao ke phale." It was the treatment I got. While my friend who is in second year going for clinical postings is being called sister. It is kind of laughable, if you ask me. That's all.
Mm-hmm. All right. Thank you, Abhinab. Again, I think this question made at least me explore a lot of things that I didn't know about. Well, again, as you all have decided to join this field of medicine, and at least, I mean, even though you all are new joining the medical college, I have at least seen you prepare for this exam, and at least you have researched about this field at least for the past 3-4 years. I want to know about I want to know from each one of you that which particular health condition is very pressing at this point currently, and why do you think so? We'll start from Debpratim.
Overall ইণ্ডিয়াত মই চাবলৈ গ'লে মানে যিমানখিনি মানে নলেজ এতিয়ালৈকে গেইন কৰিছো overall ইণ্ডিয়াত চাবলৈ গ'লে mostly hypertension and diabetes they are most prevalent আৰু তাৰ মেইন ৰিজনটো হৈছে that lifestyle poor lifestyle মানে মানুহবিলাকৰ কি হৈছে খোৱা বোৱাৰ কোনো বাছ নাই and they don't want to exercise properly. They just keeps on eating and less hard work they do. So as for India, hypertension and diabetes itu most common হৈ পৰিছে because of the poor lifestyle. আৰু নৰ্থ ইষ্টত চাব গ'লে past few yearsত কেঞ্চাৰৰ প্ৰিভিলেঞ্চটো I guess অলপ বাঢ়িছে. So maybe সেইটো reason maybe the environmental issue হ'ব পাৰে বা local practices chewing tamul and all এইবিলাকো হ'ব পাৰে গুটকা and
Okay, thank you, Debpratim. Tribenee Barman.
Well, I think the most important health issue that's most pressing right now is the mental health, because be it any age, it's affecting everyone. Every people, every profession goes through so much stress. Everyone is suffering from not clinically visible, but subtle depression, anxiety, bipolar disorder, schizophrenia, and many other things. And it's affecting every class of the people, every strata. And I think because of mostly from the lower strata, because of mental health issues, they are resorting to various criminal activities also. And I think there is a lot of social stigma towards mental health. People don't seek help. Physical, if there is any physical problems, they always go to the doctor, but it's like a taboo to go to a psychiatrist or to take any professional help for mental health issues. So I think that's the silent epidemic that's going, that's the most pressing. And also non-communicable diseases, mostly obesity due to sedentary lifestyle, eating junk food, and all working at home without reducing outdoor activities, that often leads to obesity, hypertension, diabetes at old age, and also cancer in Northeast mostly due to food habits and cultural diversity. It's also a most pressing health issue right now.
All right. Thank you, Ba. Mahir.
I totally agree with Tribenee Ba. So actually, the most pressing issue today in today's date is mental health, of course, for sure. Uh, Recently, even doctors are suffering from a lot of stress nowadays. Recently, AIR one from NEET UG 2017 committed suicide. He had everything. He had been selected for PG in radio diagnosis also, but still he committed suicide. So just imagine if the doctors could not save themselves from this issue, how do we expect a normal person who is not even aware of mental health issues to save themselves from this? I would like to present you with facts. One in every eight people suffer with mental health issues. 8 in 100 people have mixed anxiety and depression. 4 in 100 people have post traumatic stress disorder. And 3 in 100 people suffer from depression. This is the prevalence of mental health issue in today's date, but no one talks about it. And now, coming to the sedentary lifestyle of people, of course, obesity is becoming a very large issue in this country. Along with it, being from Delhi now, so in Delhi, of course, the pollution, because of pollution, respiratory issues are becoming very prevalent, like asthma. And of course, because of the water quality, also people are suffering. And because of cleanliness issue, of course, dengue is very, very prevalent in Delhi nowadays. So that's it from my side.
All right. Thank you, Mahir. Last speaker is Abhinab.
So, as two of my earlier speakers have said, mental health is an issue. We all remember what Three Idiots has shown us about the drone scene. We all remember how the friends of that character were shocked by the decisions that character took. Yes, I'm kind of forgetting the name of the character, but we all get the point here, right? So, I believe that mental health is something which can be worked on by spreading awareness about it. Recently, one of my friends has gone through a kind of messy breakup, and guess what he does for going through it, to cope through it? He is smoking. And yes, I have told him multiple times not to. But after all, it's his life. I can't make the decisions for him, but I am trying my best. But this, dependence he has got from having a love in his life to smoking, this is one of the things that mental health does, a poor mental health does to the people. As you can see, just from a bad issue in their life, he has gone from just going through life to being a possible cancer patient and much other stuff which we can carry on about. So I believe that mental health is something we need to work more and more about. And regarding the awareness thing, I would say that awareness for mental health is very important, because after 3 days, I could see that more and more friends of mine were talking about how mental health is actually a pressing issue and how they would not be doing the same decisions that the character took because of their love for their parents or any other situation. So I would say that showing the bitter side of India and the issues, it could help us a bit with how India is going with this medical disease.
All right, Abhinav. Thank you so much. It was again amazing to hear all of your perspective on this issue. Now, as we are almost done with the session, and again, we have had a lot of serious discussions as well. But now, I want a fun health tip from all of you that our viewers can follow from today itself. I will start with Tribenee.
Well, there are many health tips. The first of all, I would tell, hit the gym. Don't sit idle at home. Don't play video games inside. According to statistics, 150 minutes per week of moderate aerobic exercise is necessary, and 75 minutes of vigorous exercise is really necessary to prevent you from all type of diseases in your mid years. and also cut down the sugary drinks, junk food, also alcohol and smoking. Quit them. It does no help. Uh, then and of course manage your stress by doing meditation, yoga, and all the good things in life, and have a positive outlook to your life. That's what I'll tell.
All right. Thank you. Abhinab?
As I was already talking about mental health, I would like to add that 7 to 8 hours of sleep actually helps. Even in the last 1 month of my NEET preparation, I was sleeping 7 to 8 hours soundly. Yes, I was stressed, and yes, there were multiple factors going on with my marks at that moment. But no matter what, in the last month, I slept for 8 hours almost every day. If it was not 8 hours, it was 7 hours. I would like to say that rest your body, rest your mind. It is very important to rest your entire being. Rest is important to heal us. Yeah.
All right. Debpratim?
Actually, মই যোনটো টিপ দিব খুজিছো actually মই সেইটো নিজে মানে follow কৰিব পৰা নাই. The tip is to have meal at proper time and don't skip it. Actually, as a student, more almost breakfast to skip হয়, lunch to কেতিয়াবা skip হৈ যায়. So skipping meal is not a good thing. So I would like to advise to have proper meal in proper time.
Okay. Thank you, Mahir.
So all the tips are already given. So the only tip I can give is have a time for have a slot for yourself in the day where you don't use social media, as social media is becoming one of the most prevalent source for mental stress in the youth of the country. And of course, for exercise, do walk a lot. At least you should walk 8 to 10,000 steps a day. It will help you with your body also, and it will help you with your mind also. So that's it from my side.
All right. Thank you, Mahir. And thank you to everyone. Abhinab, Tribenee Barman, Debpratim, again, Mahir. Thank you for giving us your time. And viewers, we brought to you all 3 aspiring doctors and 1 professional today who is committed to advance healthcare in India. And with that shared commitment to passionate patient care, public health, and excellence in medicine, they each bring a unique perspective and passion. And মই আশা কৰিছো আমাক যিসকলে আজি চাইছে এই লাইভ সেশনটো সকলোৱে উপকৃত হ'ব. And it was amazing hearing from you all as the moderator. I hope our viewers also got a different point of view today, as I did. We heard from Tribenee Barman and all the others that the patient's point of view, right? And we also got to hear about the rural-urban thing. And I think one line that stood out for me from today's session that Tribenee Barman mentioned, that we do not discriminate when it comes to the treatment of the patients. Why do you discriminate us as female doctors and male doctors? I think that is the line that stood out for all of us today. And yes, as our aspiring doctors and a professional give us very fun tips, I hope the viewers will follow. Make sure to rest your body, meditate, go for walks, and don't skip meals. Anything that all of you would like to, again, tell our viewers or to Anajuri, and then we can end the session.
I would like to say that it was a fun experience having this whole webinar, and props to Anajuri for even hosting it in the first place. So thank you, Aditi, for hosting this session.
Thank you, Abhinab. It was nice having you as our speaker. Yeah, anyone else?
Thank you, Team Anajuri, for giving us this platform. You guys are doing a commendable job, and thank you, Aditi, for hosting it so well. And also the other speakers, they also it was nice hearing from them, their point of views.
All right. Okay. Do you have anything to say, Ed, Mahir, and Debpratim? If not, we will end this session.
I would like to thank Team Anajuri, of course, for hosting this session. And through this platform, I would like to send my message to all the aspiring medicos of your dreams surely come true. don't be scared of anything. Believe in yourself for sure, and of course you will make it. Thank you.
Yes, Debpratim, any message for your juniors who are preparing for NEET right now?
First of all, thank you, Aditi and the NHRE team for this platform. আৰু চবকে একেলগে লগ পাই ভাল লাগিলে, ময়ো নতুন কিবা কিবি শিকিলো। বাকী তোমালোক দুজন যে ফাৰ্ষ্ট ইয়েৰ সোমাইছা, it will be a great experience you will have in your future. অলপ ষ্ট্ৰেছো হ'ব, you have to manage it, you will learn how to manage it also. আৰু ভালকে বাছ ধ্যান দিয়া, focus on your course. It will be a nice journey.
All right. Thank you. And even I wish all of you all the best for this amazing journey that all of you will have. And yes, thank you to all the viewers who joined us today. And yeah, we all can leave. Good night.
Good night and happy Diwali.
Happy
Happy
Diwali.
Diwali to all.